The vasectomy is a quick surgical operation which makes a man permanently sterile. It's the most reliable method of contraception available. Any man can choose to have a vasectomy, regardless of his circumstances, background, or whether or not he's in a relationship. He should just be sure that he does not want to be able to father children in the future, even if his circumstances might change. The operation. The vasectomy is performed under local anaesthetic in most cases, with the anaesthetic being administered as simple injections similar to those used by a dentist. The procedure takes about 20 minutes and involves dividing and blocking the tubes, called the vas deferens, that carry sperm from the testicles to the penis. These tubes lie just beneath the skin. Openings are made in the skin of the upper scrotum, and the tubes are divided and blocked on both sides. The small skin openings can be closed with dissolvable stitches. The body safely reabsorbs any sperm inside the testicles over time. There should be no impact on sexual function or desire, and the vasectomy operation does not cause impotence. Recovery after the operation. Some pain and discomfort about an hour after the operation is normal as the local anaesthetic wears off. Paracetamol or ibuprofen is usually sufficient, and painkillers can be taken an hour before the procedure and every 4 hours after. It's helpful to ensure you have a supply of painkillers at home. Following the procedure, most men need a few days off work to recover. Men whose job involves heavy physical exertion or lifting will need longer, up to 2 weeks in some cases. Similar care is also required when engaging in energetic sport or leisure activities. Most men notice swelling and bruising of the scrotum that can last 1 to 3 weeks after the operation and will settle gradually. Swelling and bruising can be reduced by rest, cold packs, and by using supportive underwear for a few days after the operation. Stitches used in the procedure are usually dissolvable, and these break down and disappear over a number of weeks. If they become uncomfortable or irritating, they can be removed by your GP after 7 days. It is possible for an infection to develop after the operation. Symptoms to look out for are an increasing lump, persistent or increasing pain, worsening swelling, redness or discharge from the wound, and feeling unwell. If you are unsure or concerned, contact NHS 24, your GP or sexual health clinic for advice. Antibiotics or stronger painkillers may be required, and occasionally admission to hospital is needed. Bleeding into the scrotum occasionally continues after the operation, and blood can collect as a large, rapidly developing swelling or hematoma. This situation should prompt a visit to A&E. In a small minority of hematoma cases, around 1 in 100 men, hospital treatment is required, which can sometimes include an operation to drain the swelling. Fertility after the operation. After the vasectomy, you can return to having sex when you feel comfortable to do so. However, a man is still fertile immediately after the procedure, and another method of contraception must be used until you receive the all clear. The length of time this will take depends on the frequency of ejaculations. It can take 20 or more to clear the remaining sperm. A vasectomy is confirmed as being successful after a semen sample obtained after ejaculation is confirmed as free of sperm. A sample is collected at 16 weeks after the operation. If the sample is free of sperm, you'll be informed that the vasectomy is complete and can be relied on as a permanent contraception. If the sample contains sperm, we will ask you to continue to use another method of contraception and to provide a further sample. This condition is known as rare non-motile sperm syndrome, or RNMS, and often clears naturally over time. The operation does not interfere with the production of seminal fluid. so you will notice very little difference in the ejaculate fluid produced. Soon after the operation, the fluid may appear blood-stained due to the operation, but this will clear. Reappearance of blood at a later date can indicate infection, and this may require antibiotics to treat. Rarely, in about 1 to 2% of cases, men continue to produce samples containing large numbers of moving sperm following the procedure. This is an indication that the operation has failed. This result, termed an early failure, can be very disappointing. However, another operation is possible. Very rarely, for 1 in 2,000 men, the vasectomy is initially successful with a semen sample free of sperm. Then, at a later stage, months or even years later, a pregnancy occurs. It's thought, in this situation, that the ends of the vas deferens have rejoined and allowed sperm to pass again. This is termed a late failure. It's important to note that no form of contraception, even vasectomy, is 100% effective. Long-term problems. Vasectomy is a very safe, effective, complication-free procedure in most cases, but occasionally men experience problems sometime after the event. Chronic scrotal pain is defined as any pain in the scrotum lasting 3 months or more. Most chronic scrotal pain after the vasectomy is mild. In a few cases, however, less than 1 in 100 men, pain is more severe. Medical management and other operative procedures can help to relieve pain in about 2/3 of cases, but some men do have persistent pain and regret having had the procedure as a result. It should be noted that chronic scrotal pain before the procedure does increase your risk of chronic pain after the procedure. Sperm granuloma. In less than 1% of men, small painful inflammatory lumps called sperm granulomas may appear. This problem rarely persists and only very rarely requires surgery to treat. Testicular and prostate cancer. Having a vasectomy does not increase your risk of testicular cancer. The risk of prostate cancer after the vasectomy operation is still being researched. If it's the cause of any increase, this is very slight. Sperm antibodies. Following a vasectomy, sperm are still produced in the testes. As the sperm begin to deteriorate, they are seen as abnormal by the body and removed by the immune system. During this process, the body can produce antibodies against its own sperm. These antibodies don't harm the body, and there is no increase in any other autoantibody illnesses. However, once these sperm antibodies are present, a man will remain infertile even if the vasectomy is reversed. Can a vasectomy be reversed? The vasectomy is not intended to be reversible and is not suitable for men with any doubt at all about plans to have more children. Sometimes, however, feelings or circumstances change after a vasectomy. The most common reason men regret undergoing a vasectomy is the inability to father children in a new relationship, often following the breakup of a previous relationship. Reversal operations are very expensive and not available in the NHS. The chances of achieving pregnancy after reversal of vasectomy range from as low as 1 in 5 or as high as 4 in 5, depending on the length of time since vasectomy and the age and fertility of the couple. As many as 50% of men may eventually produce antibodies against their own sperm and as a result will remain infertile. There is little that can be done for fertility if this occurs. IVF and similar procedures are not available in the NHS after a vasectomy procedure. It is possible to make arrangements to store sperm for use in artificial insemination. There's a charge for banking sperm, and it should be noted that the procedures involved in artificial insemination are complicated and time-consuming, and success is not guaranteed. Other options. Vasectomy is quicker, safer, and more effective than female sterilisation. After the vasectomy is complete, the risk of pregnancy is 1 in 2,000. After female sterilisation, the risk of pregnancy is much higher. 1 in 200 women will become pregnant following female sterilisation. Alternative forms of long-term contraception include longer-acting reversible contraception for women, or LARC. These include the IUD or IUS or coil and the contraceptive implant or rod. The implant is the most effective of these, with a failure rate of less than 1 in 1,000. It's hormonal and stays in place for 3 years. The IUD and IUS have a similar failure rate to female sterilisation, but can be left in place for 5 to 10 years. For more information and to discuss contraceptive options, talk to your GP or sexual health clinic. A vasectomy is a quick, reliable, and permanent form of contraception for men who don't ever want to father children in the future. While there are possible side effects and risks involved, it's a highly effective procedure. A vasectomy doesn't affect a man's ability to enjoy sex. It doesn't change his physiology or personality. It's suitable for men of all backgrounds, whether single or in a relationship.